Vaginal discharge, it is one of the most common, recurring and irritable which is persisting for many women and giving lot of discomfort while working. This is one of the commonest symptoms we see in our practice. Discharge could be because of the dryness. First foremost common symptom is dryness, and sometimes could be due to infections, could be bacterial or fungal, or sometimes mixed infections. It could be due to some irritants when they use that undergarments, or they use some lubricants. Sometimes they may use unnecessary things to increase the sexual pleasure. Those things can do a irritation that can also cause all these itchings. So we have, first and foremost thing is have an examination. Go to a proper gynecologist, get a examination done. When you get an examination done, we know whether there is any discharge, any dryness because of hormonal insufficiency, or sometimes because of the fungal infection. If you are a diabetic or any other immunocompromised status, your fungal infection can be easily identified, like oral thrush, like that vaginal thrush will be there. And when you have a curdy white discharge, it indicates a fungal infection. When you have a greenish or foul smelling discharge, it is a bacterial vaginosis. If you have a mixed infections, you may have all kinds of discharges. Sometimes even when we remove, we may see some bleeding. So this is very important sign that you may harbor a vaginal infection which is of serious origin, or it could be because of the sexually transmitted diseases. So if you have a recurrent infections and all these findings, then it has to be treated. Your partner has to be tested and treated, and immediately with acute infection, we won't be able to take any diagnostic testing. Once we treat the acute condition, we can go for a swab culture and sensitivity test and identify what kind of organism is there. Sometimes you may have a resistant organism which may not be responding to the first line of treatment. Those cases we should give a second line of therapy or higher end course of antibiotics or antifungal treatments. Mostly that's how it is treated. If you have a dryness because of the hormonal insufficiency, your age, or sometimes your early premature menopause, again hormonal supplement can be given along with the local vaginal gel or preparations, which will also cure your vaginal itching. Third one is like irritants. Irritants, as I said, when you use improper pads or some materials during your menstruation, or when you use the garments without having a proper wash, or when you are using so much of sanitizers and antiseptics, which I don't want to name it, and they'll be frequently using, which will destroy the normal bacterial vaginal flora and cause lot of rawness and then secondary infections. So that has to be avoided. And if you are using tampon or other substances, or when you are applying some other lubricants or using oils, these again, if they are not properly certified to use internal use, and again they can cause the irritant. So all these irritants can be stopped, and you have to take some smoothing agents or some gels which will reduce your redness and itching and inflammation. Again you can go back to your original medications. So that's how all these vaginal infections are treated. Definitely you need to have an examination to know the proper diagnosis. No other test can tell bacterial and vaginal infections, and nothing like gynecological examination and swab testing. So I advise you, don't wait for too long, because these infections can become severe and can transmit it to the uterus and the tubes and cause a further damage. So the earlier you approach the doctor, the treatment will be easier and simpler, and you can be really have a relief. Thank you.